This study is actually kind of cool. Now keep in mind, we're not talking a nasal wash, but the way that salt works to help suppress viral replication, at least within the lining of the mucous membrane and so on and so forth. Now, what they discovered is this, or what they may have known, is that sodium chloride, the chloride aspect especially, helps basically feed the cells the materials to produce hypochlorous acid, which has been known to inhibit, or should I say reduce, viral replication. Now, in this case, we're looking in regard to cold in children, but still it elucidates a quite interesting mechanism in which case sodium chloride works. Now, remember too, what they're doing with the children is they're not doing a nasal wash, and that's to reiterate. They are literally just taking a few drops of saline solution, in this case approximately 2.6%, and put it in the nose, I think 4 times per day. And the results were quite phenomenal. So without further ado, let us get right into the study. Saline nasal drops reduce the duration of common cold in young children by 2 days. We'll discover about 25%. Using hypertonic saline nasal drops can reduce the length of the common cold in children by 2 days, according to a study presented at the European Respiratory Society. The results of the ELVIS-Kids randomized control trial, were presented by the Professor Steve Cunningham. The research team recruited 407 children ages up to 6 years to study where they were given either a hypertonic saline, about approximately 2.6%, the saltwater nasal drops, or usual care when they developed a cold. Overall, 301 children developed a cold. For 150 of these, their parents were given sea salt, and taught to make and apply saltwater nose drops to the children's noses. Remember, we're not talking a nasal wash. We're just talking the application of a few drops of this saline solution. 3 drops per nostril, a minimum of 4 times per day. Until well, and 151 children had the usual cold care, whatever that may be. Professor Cunningham, quoting, explains, quote, "We found that children using saltwater nose drops had cold symptoms for an average of 6 days, where those with usual care had symptoms for 8 days. So again, 2, 8, looking at approximately 25%. The children receiving saltwater nose drops also needed fewer medicines during their illness. Now, there's quite a slew of secondary outcomes, which are quite positive in reference to the saline drops. To proceed, salt is made up of sodium and chloride. Chloride is used by the cell lining. Keep in mind they use sea salt though. Chloride is used by the cells lining the nose and windpipe to produce, to reiterate, hypochlorous acid within the cells, which they use to defend against virus infection. By giving extra chloride to the lining cells, this helps the cells produce more hypochlorous acid, which suppress viral replication, reducing the length of the virus infection and therefore the duration of the symptoms. Now, of course, let's get into some of the secondary outcomes as well. When children got or received saltwater nose drops, fewer household members reported catching a cold. Secondary outcome, 46% versus 61% for usual care. 82% of parents said the nose drops helped the child get better quickly, and 81% said they would use the nose drops in the future. Again, quite intriguing overall. Now let's bring it home. To conclusion, quoting, "Our study showed that parents can safely make and administer nose drops to their children and therefore have some control over the common cold affecting their children." End quote. Quote, "This extremely cheap and simple intervention has the potential to be applied globally, providing parents with a safe and effective way to limit the impact of colds in children and family will represent a significant reduction in health and economic burden of this most common condition." and to conclude on one of the secondary outcomes, which is quite fascinating. To proceed, the team hoped to further investigate the effect of saltwater nose drops on wheeze during colds, after initial results from this study showed that children who received the drops had significantly fewer episodes as well of wheeze, 5% for the saline solution versus 19%. Now we're just talking drops. We're not talking anything like a neti pot or anything along those lines. And we're just talking a few drops, 3 drops in particular, per nostril, up to at least 4 times per day until well. Really simple application that the research discovered in this particular study. But wow, what an incredible way, in this case, to reduce the length of the cold in children, reduce the infectiousness of the cold, again, without any publisher bias, just work within the realms of the study itself in regard to secondary outcomes, caveat. And wheeze, medication use, just from, again, 3 drops per nostril. It's a minimum of 12 drops per nostril over the length of a day. And to have a 25%, I would say approximate reduction in the length of that particular illness as well, quite spectacular. Again, gratitude to the researchers. I am humble you watch and look forward to what you and I discover next week. Catch y'all next time. See you then. Bye.